Hi, Lindsay.
Hi, Sarah.
How are you?
Good. How are you?
I am well. How's your Thursday been so far?
So far so good. Yeah, it's let's see, it's starting to finally get warm in Chicago. So
Nice.
um
That's that's good to hear. I'm coming to Chicago in like 2 weeks, and sometimes my I don't know plane gets canceled because there's still snow this time of year.
are you coming for the Shamrock Shuffle?
No, just for fun. I'm from Chicago, so I'm gonna go back and see some of my girlfriends.
Oh, okay. Very cool.
Yeah. Yes, yes. Are you running the Shamrock Shuffle?
So actually I don't I haven't decided. Like I was telling you, like I'm actually having dental surgery tomorrow.
Oh, that's right. Okay.
Long story. Anyway, when I was 11, got my front tooth knocked out. So I have to actually have like the tooth now pulled and have an implant put in. Um,
Mm.
so kind of a bummer. So I'm not yet sure, if I'll do it. Kind of depends on how I feel.
Yeah,
But
yeah. That would kind of be a wait and see how you feel thing for sure.
yeah. But it's an awesome race. I really want to. Like I've done it the last like 3, 4 years.
Yeah,
So
nice. Yeah, the racing energy in Chicago is really unparalleled. I love racing in Chicago.
yeah, and I mean, race, it's like as big as like the marathon in some ways, not like the crowd, but like there's like thousands of people that run it. And it's the start and finish are right where the marathon start and finish are too.
Nice.
So yeah.
That is awesome. Well, hopefully you can get out there. But let's get started. I would love to just know a little bit more about you. Like, what's your practice? I mean, you live in Chicago, but what do you do for fun, and how does running kind of fit into that?
Yes. So yeah, live in Chicago. I work part-time at University of Chicago Medicine, and
Nice.
teach our PT ortho residency and then manual therapy fellowship. And then yeah, I have Plass PT and performance with an emphasis like you on treating endurance athletes with hip issues. And then I also really enjoy the performance coaching
Nice.
aspect, coaching for running and triathletes, and kind of bridging that gap of like getting, back from injury, now back to racing, back to performing.
Nice.
Uh,
I did not know that you also taught. That is amazing.
Thanks. Yeah, it's something I really enjoy doing, working
Yeah.
with, grads. I think stems from a lot of, so I've been out of school now 11 years.
Yeah.
I enjoy kind of helping newer grads learn all the things that I know. I wish like
Yeah.
all the things I just know so much more,
Yes.
after out of school. Um, and I can tell you in some ways how that kind of like relates to my hip and like the trajectory of my career. I don't know if you want me to jump into that.
Yeah. 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 Go for it. I would love to hear that.
Sure. So yeah, so let's see. Graduated in 2012 from physical therapy school. And then at that time, so taking a step back, so I played college soccer, always loved to run. Got into marathons when I was a senior in college. My sister had convinced me like, hey, run the Go St. Louis Marathon with me. Um, so we did, and then I was like instantly hooked, and then kind of the goal became like I wanted to qualify for Boston,
Yes.
uh, like coming within minutes of doing so. Long story short, was like running a lot after college, not doing as much strength training as I should have been. So around like 2013, so it was kind of a year out of PT school, and had just ran, like 6 marathons in like 4 to 5 years. Yeah, it was a
Wow.
lot. Um, at that point, like my hip was hurting. But again, being a newer grad, like I didn't know that much about FAI, about labral tears. Was kind of running through it, hoping like, okay, maybe this will go away. And then in 2014, I actually moved to Baltimore to start a physical therapy residency at Johns Hopkins. And then that's when it was kind of becoming like a limiting factor. And so I ended up getting an MRI. And that's when things kind of like spiraled from there. So the MRI was actually ordered by a sports med doc to rule out a stress fracture.
Okay.
Just because I had like the pain for so long.
Yeah.
Good news was not a stress fracture, but then yeah, it showed like incidental findings of a labral tear and cam and pincer morphology.
Okay.
So at that point, I again like it. And even in the research world of FAI and labral tears, like there were only a few kind of consensus papers out at this time, right? So there wasn't, a lot of research out there. So I guess kind of in my mind and based on what I had seen previously in the clinic, I thought, oh, like, of course, this needs surgery, And so I go to see the surgeon, and I guess stop me if you have any questions or like.
This is good. This is so good. I love it. I'm eating it up.
Okay. So then I go to see this surgeon in DC, and the first thing is I regret I went alone. So this is when I was like in my like mid 20s, and I wish I would not have been alone, because it's just, I think you need somebody there to go with you.
Yep.
And then went there, like had my imaging, and kind of within like 5 minutes of meeting me, like of course holds up the imaging, is like, oh, you have this labral tear, you have cam, pincer impingement, like you need this hip arthroscopy. And I can remember just like instantly kind of like just started like crying. Yep. Because you're walking, even as a PT, and so that's where it's like I reflect on that a lot, that even like me, someone who's in healthcare, like this still kind of happened to me. Yeah. And so then I remember like asking, well, I run marathons, like, can I keep running? Or, and I remember like the surgeon's like, oh, you have to stop running. You need this surgery, or you'll end up getting a hip replacement, like kind of all the things at once. And then I feel like I kind of just rushed into getting like the diagnostic injection. So that's another thing I wish I would not have done, like on the same day, like, same appointment. I remember like, we can offer you this injection, and like next thing you know, I got it. And it did not really make a difference in my pain, which is another reason why I eventually like did not go on to have surgery.
Yeah.
So from there, I leave this appointment kind of thinking like, shoot, I need this major surgery. I have to stop running, and like really kind of had like catastrophizing thoughts from this experience. And also at the same time was like in this residency program and not really wanting them to kind of find out what is going on. So trying to like deal with this all on the side. Yeah. And was actually doing physical therapy at a clinic, not at Hopkins, where I was doing my residency. So an outside clinic. But like that, their like emphasis was actually on just like, let's get you strong for surgery. Like didn't really kind of bring up this idea that, hey, maybe you can get back to running without surgery.
Yes. Yeah.
So then luckily, like one of my mentors in the program stepped in and was like, hey, like what's going on? Like the past like 5 months, I've noticed like a change in you. Like you're quieter, you're like, you seem down, and then just kind of down, like this is what's going on with my hip. I haven't been able to run. And he was like the first person to really kind of be like, well, why haven't you been running? And then I literally, my answer was like, well, because this surgeon told me that if I run, I'm going to make my hip worse.
Yeah.
And I think I really thought that, like, and he's like, well, let me evaluate your hip, and said I can't make any promises, but, let's see what we find, and like, if you can get back to running. And so, yeah, so because at that point I had actually taken like 5 to 6 months off of running,
Yeah,
and my
it's a long time. Yeah.
like it wasn't getting better the
Yeah.
rest. And so then like working with him, you know, over time, like I would say it was probably kind of like a 2 to 3 month period where sessions were like every 1 to 2 weeks. I eventually like did get back to running, like started running. And at this time again, there's like nothing, this is back in like 2014 going on 2015, not a
Yeah.
lot out there.
Yep.
So, you know, I remember he had kind of said to me like, well, then you have to be your own experiment. Like, you know, if there's nothing out there that really, because my kind of question was, like, which to this day is still $1 million question. Like, if you run with a labral tear and FAI, like, will you make it worse? Right? It's so multifactorial that now, like, I know the answer is we don't know. Like,
Yeah.
it so depends on a lot of things for each individual person.
Mm-hmm.
And yeah, so I think so then I was able to get back to running, and long story short, get back to marathon running. And then eventually, like what has really helped me is getting more into triathlon.
Yeah.
So, you know, I actually, my first race back, I guess you could say it was in 2015 was a triathlon.
Right.
Like, so kind of getting back into the swimming, the biking really helped kind of keep my training more well-rounded.
Yeah.
So
That's amazing. I really, really enjoy just hearing you go through like the whole process, because I've just seen this time and time again of like a young woman walks into a doctor's office alone and is told like all of these really scary things. And then it leads to this path of like, I should never do this. I can never do this. And then it can really go down this like catastrophizing route. And we need more hope in that space of saying like, yes, you can get back.
right, and at least options. And I think at least like my, I guess now kind of how I approach it in like my, what I wish people could experience like when they do go see a surgeon is that not this idea that like it has to be surgery or physical therapy. Like it's really like regardless of if you get surgery or not, like these patients need physical therapy.
Yeah.
Right. Like, and then I think, okay, a select few may really benefit from the surgery.
Yeah.
But there's so many nuances to like who benefits, and to like why someone may have pain that again, I think we have to like move away from this argument of like surgery or not, and just understand that like for each person, it depends on a lot of individual factors.
Yeah.
And like that being said, meaning like I wish that surgeons would kind of tell that to patients, like look, like, you know, kind of telling them like these are the statistics of, you know, nearly 75% of people have labral tears, not always the cause of your pain.
Yeah.
You know, and saying like, you know, you can try physical therapy, and yeah, kind of approaching it that way instead of like making it like, oh, you have this condition, your hip is doomed, like you need surgery to fix it.
Yes.
So
Yeah. Yeah. My like number one advice when a woman is diagnosed with this or is going through this is like, have your team. I used to have the dream team here, but my surgeon is no longer taking new patients. And it's like PT, I have a physiatrist and then a surgeon. And like everyone looks at each other, and the physiatrist looks back to the PT, as well as the orthopedic surgeon looks back to the PT to say like, I need you to perform this level of physical therapy if they get surgery. Like it's just such a good trio to have options and people that are like on your team.
right, exactly.
How do you feel like this has influenced your career as a physical therapist? Like, did that cause you to go into physical therapy, or well, I guess it happened after. But how has it like changed your practice now?
Yeah, so then I think like again back, this was like 2013 2014. So like to go on kind of a little tangent, I remember at CSM, like combined section meetings. So for those who are not PTs, it's like this annual conference that's really big. All the PTs kind of in the country, you know, are in one spot in one conference center. Anywhere there was a topic on the hip, and Mike Raymond specifically, who has been like a great mentor to me to manage my own hip, as well as just like all the great things he's done for research. So I remember like asking this question, like, you know, will running with a labral tear cause hip osteoarthritis? And I remember like his answer was like, we don't know yet. And if I were you, I would keep running. And so that kind of like, you know, just was so reassuring to me to kind of hear like, okay, the top experts in the world still have so many questions about the hip. And from that point on, I guess for my own journey, started to notice that like friends who had labral tears, and then like friends of friends were kind of contacting me and, you know, hearing about my story and asking for advice. And then I think that's kind of how like my passion and kind of specialty towards helping athletes like us with hip issues kind of developed from there. And you probably know this as well. Like I think for patients, like when they meet someone like us who has the labral tear and FAI and they're kind of describing their symptoms, like I feel like once they find out that we also have it, like it's kind of comforting to them, because like I know how they feel, you know. And so I think it's a unique ability to kind of relate to patients. And you know, sometimes people will say, you know, like, oh well, you just don't know what this pain is like, or like, you know, and then I'll be like, actually, you know, let me just tell you, like, I also had, you know, pretty severe hip pain, and go on from there. So.
Yeah, for sure. Yeah, it's been such a game changer. And I think the time in which it shows itself for women is like, I mean, it's different for everyone, but like I would say my like median mean age is like anywhere from like 25 to 40. And that's such a crazy time in women's life where they're like transitioning from, you know, college to their professional life and maybe getting really into a new sport, or they're like planning on having kids, and then their body changes with that. So I just think all of those factors plus dealing with this like new thing of like a hip labral tear, FAI, whatever it is really hard to pin down. So I like having that, I don't know, like being kind of in that space with them around the same age.
Right. Yeah. And then like that kind of leads to a whole nother topic of how, especially for women, like the connection between the hip and pelvic floor.
Yeah.
So I trained in pelvic floor physical therapy, but my coworker and really close friend, who's also named as Sarah Macarag. So she is a pelvic floor specialist, and we often share a lot of patients, you know, because a lot either are coming in with a pelvic floor diagnosis that then, you know, Sarah's like, hey, I think actually it's more their hip, or vice versa. They're coming to me, you know, with the diagnosis of like labral tear, but then we find out, no, maybe this is actually more pelvic floor. That's a really important thing that again, there's like not a lot of research currently out there. And I think that what I have seen in clinic too is that if that connection doesn't get diagnosed, and say someone goes on to have like a hip arthroscopy for their labral tear and cam morphology, but really the cause of their groin pain was actually pelvic floor, like that's a reason I think that, you know, sometimes I'm seeing people that end up having persistent hip pain.
Yeah, I mean, it's literally just right next door to the hip. And like, if something is going on with the hip, it can cause like increased tone or decreased function in that area. And like, whether it's the primary cause or the secondary cause, I totally think it's important to be addressed or checked regardless.
Right.
How has your hip been since? Like, how are you able to manage it? What kind of things like are you able to do? Does it bother you from time to time? How is that going?
Yeah, so it's kind of crazy. I was just thinking about this. Like it's actually going on like 10 years since my hip had started hurting. So I'm pretty, in a way, like pretty like proud of that I've made it, like, you know, because I think initially that was like a 10-year thing that the surgeon had threatened, like, oh, in 10 to 20 years, like, you know, your hip is going to need hip replacement. And I can like say that I would say that my hip kind of 95% of the time doesn't bother me.
Yes.
And honestly, I think that that's a big thing that I try to educate patients on, is that I think that's the goal, right? Like, if you know about Jo Kemp, who is an amazing Australian physiotherapist, she always, you know, in all of her research, always emphasizes like, if you have FAI and a labral tear, even if you have surgery, like your hip is not going to be the same as kind of a hip that never had FAI or labral tear.
Yes.
So kind of setting that expectation of like, you know, your hip doesn't need to be 100% pain-free for it to be a great hip. So say 90% of the time, like my hip doesn't bother me. And it actually feels best when I'm exercising, like when I'm swimming, biking, running, right? And I think this is also common for most people. Like the time that it bothers me is prolonged sitting, really. Like I have to go on like an 8-hour flight, or like sitting, say like at a conference or something, sitting all day, like that's a little cranky. But I think now, like having that knowledge and kind of understanding like the triggers, so knowing like, hey, if I'm gonna go on an 8-hour flight, then I know, okay, my hip may feel a little bit stiff, a little bit achy, but when I get there, like I'm going to do like my mobility and my exercises, and like it will get better. Kind of just because you have like a flare up, it's not like the end of the world. And I think that that's something like I emphasize a lot with my patients, like understanding, I'll call it in some ways like a rescue plan. Like, hey, what are the things that you can do to kind of decrease like some hip achiness or pain? And I think the other like big thing is just knowing what positions for like squatting and deadlifting feel good for your hip. And again, I think we can't like make generalizations for this kind of patient population. So like squatting, right, is a really kind of, I guess you could say, like lots of people love to debate like stay like in a range that feels good for my hip, like in a I say inch-free, pain-free range. And then for deadlifts, I really like using a hex bar or trap bar. So so I think that's kind of like, I think the biggest thing for people to know is like it can take a little bit of time for you to figure out like what feels good for your hip and what doesn't, and kind of modifying things and knowing when to back off, right? So I know that deep squats, like loaded deep squats of the weight, don't feel good, right? So I'm not gonna just keep like pushing it. Sometimes I think patients can kind of feel like, well, I was able to deep squat like 5 years ago, you know, why can't I deep squat now? And so that can be a hard kind of thing to grasp, that like you may have to make modifications in order to keep your hip happy. And kind of like the concept of like risk versus benefit. So it's like, you know, with deep squats for me, I know that the risk of kind of flaring up my hip or having pain like is higher, and I know that the benefit is just not there, versus I can kind of keep my squats like at 90 degrees or a little bit lower, and then, you know, I have no issues with pinching or pain.
I love that. I think that has been, maybe I'll speak for my patients, but I feel like that's been the most beneficial thing for them, is to have someone walk through with them like just a season of life and say, like figure out exactly what their aggravators are. So for some people it's like sitting, for some people maybe it's running 3 miles and they haven't developed tolerance to go longer than that. Maybe it's just different positions, and like being able to modify it and then going forth and living a really full life with these small changes.
Right.
Yeah, that's been awesome. My final kind of question for you is, what advice would you give to anyone that is maybe going through this, and like wants to get back to high level activity?
Yeah, so I think the first thing, so let's kind of start at the beginning. So let's say they have hip pain. I would say I would be like, unless there's reason to believe there is a stress fracture,
Mm-hmm.
you know, so if there's reason to believe it could be a bone stress injury, which, you know, actually a lot of the times when there is, like in a runner with hip pain, with groin pain, we do have to really be cautious of that.
Yeah.
So, you know, if they get an MRI, understanding that, hey, like we're mostly looking for a bone stress injury, and kind of educating them ahead of time. Like it may show you have a labral tear, may show you have cam morphology, but that may not be related to your pain.
Yeah.
And then like from there also, I think, you know, if you're lucky enough to be working with the patient at the time, but let's say they've already come from kind of the surgeon's office and are told they need surgery. I guess understanding that, like, you know, try physical therapy, like try 3 to 6 months, you know. In Europe and Australia, like the standard of care is actually like closer to like 6 months to a year,
Mm-hmm.
you know, different kind of here in the US. So understanding that like this condition takes months to get better. And so trying physical therapy, making sure that you're connected with a physical therapist who understands this condition,
Yep.
who really kind of specializes in treating the hip. And then from there, like, I think if they're going to pursue surgery, like getting a second opinion. Again, like this could be another topic, but because when I had got a second opinion and like was offered 2 different surgeries, you know, so even like the nuances of the hip arthroscopy procedures,
Yeah.
you know, can vary. So I just think that you have to kind of get a second, maybe even third opinion, and really understand like the risk versus benefits. Last thing I'll say is, like, I think oftentimes when we think of hip arthroscopy, we think of it as intended to kind of like repair the labrum or like, you know, fix the hip, but we forget there's actually like iatrogenic kind of consequences of the surgery.
Mm-hmm.
That could make your hip worse, or kind of cause like the cascade of arthritis to occur. So I guess just understanding, like, it's not like a hip arthroscopy is like an easy surgery to recover from.
Yeah.
So you don't, and because I think unfortunately it's kind of advertises that, you know, like as like, oh, this will fix your hip and you'll be okay. But I wish that it was that simple. And I guess clinically what I've seen is that, like, you know, people still end up having problems.
Mm-hmm. Yeah, for sure. I like that, just having like a really good understanding of the risk and the benefits of all aspects. And then I think once you've seen everything, like, you'll know. Like, I've just talked to so many women and they're like, I just knew that I didn't want to have surgery, or like I knew that the surgery was for me. And like, I'll support whatever decision they want to make, because ultimately that is what's going to get them better. It's what they believe is going to get them better.
Yes, totally. And I think that's an important thing too, like, knowing that, like, you know your body best, and kind of like, if just finding people that will support you, like, even, you know, like, that's kind of what I'll say to my patients, like, you know your body best. Like, if you feel that like surgery is best for you, then maybe it is, you know, and just support them with whatever they decide.
Yeah. Yes, for sure. Okay, my final question for you is, where can we get more from you? Are you, where's the best place to access you if we want to see you as a patient, or are you on any podcasts or websites or anything?
Sure. So people can reach out to me, either on here, or you can go to my website, which is plassptperformance.com. I have done a few other podcasts. It's also linked on my website. I was on the Runner Zone podcast with Chris Johnson, and then the Run Smarter podcast with Brody Sharp. And then if you're a physical therapist, I was also on the JOSBT Insights podcast, Claire Ardern, Dr. Claire Ardern. So
very nice. Awesome. And then in Chicago, do you treat like concierge, or do you have a practice?
Yeah, so my practice is mobile.
Okay.
So I go to the patient, and then if you're in Illinois, I can also offer virtual therapy. Yeah.
Nice. Awesome. Well, thank you so much, Lindsey, for coming on. I really appreciate it. You're like a wealth of knowledge, and I'm excited that you're in Chicago and I can refer any of my Chicago people to you.
Thank you so much, Sarah. Thanks for having me on.
Yes, of course. I will talk